So let's talk about fatigue. So this is a common complaint that patients come in with to my practice is I'm just tired all the time. And so there's a lot of things that could be causing fatigue in patients, even in their 20s, 30s, 40s, 50s, whatever the case may be. There are multiple reasons why someone could have fatigue. One of the number one reasons I'm seeing in my practice is vitamin D deficiency. So we know vitamin D, most patients are deficient in the US. Yes, that is the sunlight drug. The vitamin D comes from the sun. So it's relatively easy to supplement, but patients aren't being tested for it frequently enough. Another reason that you could be having fatigue issues is maybe an underlying thyroid disorder. So I do find, since I used to work primary care environment, that we typically will just draw a TSH on patients, but we know that the underlying autoimmune disease that's kind of hidden is called Hashimoto's disease, which is very prevalent in women the age 35 and above. It is actually the number one autoimmune disease in women of that age category. So we test for Hashimoto's disease in our clinic. It's an antibody test, same as with your basic lab work, we would add that on. But we not only look at your TSH, and I think that's important. So also, something else that can cause fatigue would be potentially a B vitamin deficiency. So we know B vitamins are super important, and for the most part, our environment is pretty saturated in it, but a lot of patients have absorption issues. So even if you're taking a B supplement orally, your gut may be destroying most of that. So maybe you're only absorbing 10 to 15, at the most 20% of what you're taking. So therefore you're B deficient. So that's something, we're gonna look at in your labs as well. Hormones play a crucial, huge role with my patients is, do you have low testosterone? We not only focus on total testosterone, but free testosterone, because free is what's left over for your body to use. It's unbound to things like estradiol and other hormones that kind of play a role there. And that part's super important. So we know we're not like a cookie cutter clinic that everybody gets the same dose on the testosterone or thyroid medication. We really make it specific to the patient and their symptoms, as well as their lab work that's coming back to us. I encourage you, if you're struggling with fatigue, that you reach out to us. We're going to do everything we can from our end to figure out what's exactly going on. But once again, I encourage you to give us a call if you're struggling with fatigue. We look forward to seeing you.